Hello, this is Dr. Kashif Abdullah. Um, I wanted to speak to you today about prevention and the United States Preventive Task Force. Um, let's see. Just letting you know, I do this basically from about 12:30 to 1 o'clock today. I'm starting a little bit late, but I was thinking of also doing another chat maybe around 5 o'clock, seeing if there's any better response in the number of viewers. So maybe there's not that many viewers because it's lunchtime here in California, or people are working, or what have you. It's 3 o'clock in the East Coast. So I'm gonna try maybe at 5 in the Pacific, 5 o'clock here in the Pacific Standard Time Zone. Maybe getting a better response. But today I wanted to talk to you just a little bit about prevention and an application you can use yourself. Um, so the application, let me share the screen first. Let's see. Um, Switch. All right. So the application is this. It's called the United States Preventive Services Task Force. They're basically a bunch of public health officials under the U.S. Department of Health and Human Services, and this is like a screening questionnaire that all doctors can use. Actually, all the insurance companies use this in order to determine benefits and eligibility and stuff like that. And we can use this like as for physicians, we use this on an if you want a daily like an annual checkup. What should we check on an annual checkup? One way of doing this is to come here, the United States Health and Human Services website. Sometimes it's a little bit hard to find this exact place. So if you want, you can just go to my website. I know that maybe sounds like I'm plugging it, but just put in Kashif Abdullah MD, and you scroll down and you'll see right here, use this screening tool to figure out screening tests that you might need in the future. You click that, and when you click that, this pops up. And I want to show you. So I actually had two patients today, husband and wife, that came in, and I used this to discuss what their annual checkup would look like. So let's make up somebody. Let's make up a 50-year-old man, right? And let's say he smokes, and let's say he's sexually active, okay? And we show recommendations. So there are there's actually 5 recommendations: A, B, C, D, and I. A and B are recommended recommendations to do an annual checkup. C are selectively recommended checkups, and then D is not recommended at all. And then there's I as uncertain. Do we do them or not? So usually I'll just go through A and B with patients. So for this man who is 50 years old, who is sexually active and smokes tobacco, what would we do? So for him, we would do colorectal cancer screening. That's that's where we look for cancer in the colon, and that's the digital rectal exam. This is where we put the finger in the bum for the man. Um, Technically, we can do this for a woman too, but it depends. We can also do, usually that's not the best way. The best way actually is a colonoscopy. A colonoscopy is much better than a finger in the bum. Then we would check HIV screening. We would also recommend, if need be, HIV preventive medications to prevent those with high risk of HIV to acquiring it. We check your blood pressure. We check if this person has had syphilis, or screening questions. Tell them about trying to prevent tobacco smoking. We speak about aspirin use in ages 50 to 59, and those with coronary vascular disease risk of greater than 10%, depression. We check diabetes, Hep B, Hep C. We talk about tuberculosis. We talk about behavioral counseling for behavioral sexually transmitted infections, statin use for those people to prevent coronary artery disease, unhealthy alcohol use, and weight loss. So I would do these on an annual checkup and go through these various questionnaires with patients. And there is another one right here. If you are wondering about say you're in your 40s and beyond, and you want to know what is your risk factor for coronary artery disease, well, you can actually just look this up. There's a calculator right here from the American College of Cardiology, American Heart Association, and it's a risk calculator. You put in, say, a 50-year-old man, right? And we'll say he's not African American. We'll make up his cholesterol as 200. and because LDL is like say 40, his blood pressure is let's say 140 over 90. Let's make up something like that. We'll say he's not being treated for high blood pressure, he's not a diabetic, and he's not a smoker, right? And or we'll say he's a smoker. Then we calculate. So this person is at 11.2%. So he's age 50. He's at the cutoff limits of normal for cholesterol. This is stage 1, this is possibly stage 2 hypertension, and he smokes. So we would recommend stopping smoking, maybe starting a blood pressure medication because of this, and even starting aspirin at 81 milligrams to prevent a stroke or heart attack. But if we ask this person to lower their blood pressure, say to 130, say no, let's about 130 over 85, right? And now they're 51 years of age, let's say that. And we tell them they don't smoke anymore. If we check the see how much it dropped? It dropped from 11.3 or something to 4.9. See the big drop? Just by in 1 year of dropping the blood pressure from 140 to 90 to 130 over 85. But the real kicker was stopping the smoking. That's what really changed it. And I can prove that to you by just saying yes to smoking. See that? That's 5 percentage points right there just from smoking. Just from smoking. And the other, there we go. So smoking is huge in preventing so many diseases, especially heart disease and stroke. But these are risk calculators I want to show you that you can find online, and you can actually present this to your doctor. He or she can actually follow these guidelines, and you can get this entire thing done on an annual checkup. Usually, if the insurance says on an annual checkup, this is free, that is free, well, this is the free things on the annual checkup. Let's see if there's any questions. No questions at this time. Okay. Well, those were just something quick and easy. Let me discuss to you today about also the coronavirus picture. Where are we at the coronavirus issue? So we look at coronavirus. Let's see. There is now approximately 4.8 million total confirmed cases, and there's unfortunately now 321,000 deaths. There has been, unfortunately, in the United States alone, 1.5 million cases and 91,000 deaths. That is unheard of numbers. The number of cases are still falling, and it's on a negative trend, but the U.S. has a long way to go, and I think they're going to prematurely open, and a lot of states, frankly, I believe, are acting irresponsibly in opening up their states, thinking that they're okay. Let's see. So, and then if there's Russia, we can see that they're saying that there's a drop. That's good, but they had a sizable increase. They're number 2 now. Brazil is also dramatically increasing in the number of deaths. United Kingdom is slowly falling, not as high as the U.S., but they're side like the U.S. falling. Spain has really controlled their cases. Italy has done a marvelous job. Italy, I would say, went through a lot of pain, but went through a lot of work and doing the right thing of contact tracing, isolation, or testing, contact tracing with testing, and then isolation of those people, and then testing those people that they came in contact that were positive, and isolating again those who are positive through contact tracing. They have done the right thing, and they, by the end of this month, maybe middle of June, they will have likely been effectively controlled this disease. France, same thing. Germany has done a marvelous job as well. I would say most of Western Europe has done a great job. Turkey is also doing a good job. Iran likely are going through a second wave right here. India, unfortunately, is just escalating exponentially, like Russia. I would imagine at one point India, Russia, and maybe Brazil, South America are going to be in the top 5 of all the cases. Peru is also increasing. China is just not even worth speaking about. Canada is slowly dropping. Their number of deaths are now only 6,000. Not only, but that's a lot. 6,000 deaths from this one virus. But their case numbers are dropping. Their numbers actually are sort of like Europe, only because, but the only thing they never had a large hump of increased cases. They had like here, but they've come down a good amount. Saudi Arabia is just skyrocketing high. Belgium, it's dropping. Mexico, just like Russia's and India, is exponentially rising. Chile is also increasing. The Netherlands are dropping significantly. Pakistan is also increasing to some degree. Qatar is also increasing. Ecuador, not enough data really. Belarus, increasing as well. But staying stable in Belarus. That's good. So I would say Western Europe in general will be the first continent that'll be out of it. And in Asia, it was likely just South Korea. And in Australia, it's Australia and New Zealand are controlled significantly. Um, let's see. Recently, I have heard news. Let's see if there's any questions. Oh, there is one question before we go to any more of that. I want to answer this question. Let's see. If someone tests positive for COVID-19, how long will that test show up positive? Someone may have already asked this question. Okay. So the question is basically if someone is tested positive, for how long will they show up positive? It depends on what kind of test you're doing. If you're doing the antibody test, then you're always going to show up positive, likely, until the antibodies are gone. But that takes a long, long, long time and may never go away. So that just shows you've been exposed. Now, if it's the DNA test, that's going to go away after your immune system has destroyed the virus. So, how long will the test show up positive? Again, if it's DNA, it may be only a couple of weeks, and then once the virus is gone, it's gone. You don't have it in your system, you're going to show negative. So that could be about a couple of weeks. But the serum test for antibodies never goes away. Will not go away for a long, long time. So that can be possibly years. But let's see. Oh, I wanted to talk a little bit about the news about coronavirus. Let's see. So the biggest thing recently has been people's concern about the lockdown, of course, in the U.S. But the U.S. is not doing the proper thing of testing, contact tracing, and isolation of those positive. But the U.S. president apparently is now taking hydrochloroquine as a preventive measure, which is frankly irresponsible. I don't know which doctor is actually giving him this medicine. Unless he's had malaria, there's no point for this medicine. So I don't know. And the thing is, you can only get this medicine through prescription. So he's forcing some doctor somewhere to say, give it to me. You can't just randomly get this medicine. Even the United government, even the president can't just go to the pharmacy and says, give it to me without a doctor's prescription. So some doctor somewhere is giving it to him. I think that's wrong. This can cause arrhythmias and heart attacks. So this is something you should not do. Don't go to your doctor and say, I want hydrochloroquine, because in all likelihood, we're not going to give it to you. We're not going to give you azithromycin just for the heck of it, unless you have like pneumonia or coughing or some kind of infection, ear infection or what have you. We're not going to just give you azithromycin. You can even take zinc if you want. Zinc has been shown to somewhat help with prevention of the adherence of of viruses to your throat. I'm not speaking specifically of COVID-19. I'm speaking specifically of any cold virus, which is actually, incidentally, a coronavirus. So cold virus and coronavirus are very close. Okay, so let's see. Is there any questions? No questions so far. That's okay. Well, like I said, I'm going to be doing this again just to see if there's anyone out there around 5 o'clock Pacific time zone or 8 o'clock. I'll cover the same things again. I want to see how things are going. Maybe I get a better response at 5 o'clock. I'll switch over to 5 instead of from 12 to 1. Well, let's see. Let me just switch cameras here. Oh, this is Dr. Abdullah again. Thank you again for another episode of, I guess, the world turns. Hopefully they don't sue me for that. Again, if you have any questions or concerns, please feel free to ask me in the comment below. I'm here to help. Dr. Abdullah signing out. Thank you. Bye-bye.